Did you know if left untreated for too long, carpal tunnel can lead to permanent dysfunction of your hand, including total loss of sensation in your fingers and extreme weakness? That's something nobody wants. So let's talk about 9 warning signs of carpal tunnel you should know. Carpal tunnel syndrome is a condition caused by median nerve compression. The carpal tunnel is a passageway on the palm side of your hand created by your wrist bones and ligaments. It allows the passage of your flexor tendons and the median nerve. The median nerve controls the movement and feeling of your thumb and all your fingers except your little finger. Inflammation within the tunnel can result in median nerve compression, which causes numbness, tingling, or weakness in your hand. So what are the signs of carpal tunnel syndrome? It usually has more than one cause and can often be further aggravated by repetitive activities in the workplace. Here are the most common signs and symptoms of carpal tunnel. Number 1. Usually the first symptom of suffering carpal tunnel syndrome is hand numbness and tingling, primarily on the palm side of your thumb and fingers. Number 2. Also, you can experience decreased sensation in your fingertips, making it harder to feel textures and surface temperatures. Number 3. The loss of strength in your hand. Have you been dropping things more frequently? When combined with numbness, the loss of strength makes it difficult to grasp or hold on to everyday objects and is commonly associated with carpal tunnel. Number 4. Surprisingly, pain is rarely the first symptom. However, discomfort or pain in your hand, wrist, and forearm can definitely occur as carpal tunnel syndrome progresses. Also, if this pain in your hands or wrists flares up out of nowhere, carpal tunnel syndrome could be the cause and should be considered. Number 5. With weakness and pain, you will lose the ability to perform everyday tasks with your fingers. If you have recently found it more challenging to type on your phone, button your shirt, or fold your clothes, it may be a sign that you suffer from carpal tunnel syndrome. Number 6. Are your hands feeling stiff in the morning? When you sleep with your wrists flexed or making a fist, it may cause an accumulation of fluids in your hands and wrists. These fluids place extra pressure on your median nerve, making it difficult to use your hands in the morning. If the stiffness goes away as the day advances, it may be a sign of carpal tunnel syndrome. One great way to combat morning hand aches is using a nighttime compression garment like these compressed bamboo gloves. They will provide a soothing compression throughout the night and keep your blood flowing to reduce the fluid buildup. You can find a link for more information on these in the description. Number 7. Another telltale sign of carpal tunnel is itching, burning, or tingling sensations in your hands. This can be your body's way of signaling that your median nerve is compromised. Number 8. The feel of your fingers are swollen without the obvious visual aspects of swelling, meaning your hands and fingers will feel extremely swollen, but when you look at them, they will look normal. Number 9. Lastly, and less common, the feeling of cold hands can indicate you may have carpal tunnel syndrome. And one important thing to keep in mind, if the constant pressure on your carpal tunnel causes your hand blood vessel to narrow, you are much more susceptible to suffering Raynaud's disease. Raynaud's disease is when blood vessels constrict when exposed to cold, resulting in cold hands and fingers. In conclusion, when left untreated, carpal tunnel syndrome can permanently damage your nerves, leading to irreversible numbness, tingling, or weakness. But when diagnosed and treated early, you may be able to stop the progression of the disease. If you are experiencing any of the symptoms mentioned before, don't hesitate to talk to your physician. Especially if you spend all day on a repetitive hand or wrist activity, like typing on a computer, knitting, or hammering. Your physician may perform sensory testing to determine if it is carpal tunnel syndrome or something more serious. We hope this video helped clear some of your questions up about carpal tunnel. Please don't forget to click the like button and subscribe to our channel if you enjoyed this video. We are constantly putting out fun videos on everything related to wellness. Please remember, this video is meant for educational purposes and is not medical advice.